So over the weekend, serious concerns emerged over reports that unclaimed bodies were accumulating in the Helen Joseph Hospital mortuary. This is following administrative delays blamed on the shortage of printing supplies. However, the Gauteng Health Department has firmly denied these claims, stating that all cases were addressed in a timely manner. Gauteng Health spokesperson Mutaletale Mudiba confirmed that between June 17 and June the 23rd, the hospital experienced printing issues due to late payments to suppliers. Meanwhile, DENOSA in the province has blamed the poor governance within the hospital. And for more on this, we are joined by Bongani Mazibuko. He is with the DENOSA in Gauteng. A very good morning to you, Bongani. Thank you so much for making time for us this morning. What's the situation like currently?
Good morning, and thank you for having us. Well, the situation, it's actually, it's not good, in that we can confirm that the shortage, there's been a shortage of printer cartridges at the facility. And we, as we had said in an earlier interview, that we believe that this is definitely a lack of, it is due to poor governance and lack of management processes and systems in place. You cannot have a hospital as big as Helen Joseph, being one of our tertiary hospitals in the province, running out of printed cartridge. And this in itself affects service delivery and the functioning of the hospital in the different wards and different departments as well.
Yeah, what's the explanation around why they weren't printing cartridges?
It comes back to payment of suppliers, apparently. Because from what we've been told by our members on the ground is that apparently the whole hospital is relying on one printer cartridge at a time. And throughout the whole hospital, anybody that needs to make copies must go to one particular place. It's a centralized process. And as soon as that printer cartridge is out, it means the whole hospital is unable to make copies or to print any more documents, which we find as upset, to say the least. Because in terms of, we are still very much paper-based in the department. It affects our members and it makes it difficult for them to do their job. The nursing council expects nurses to record whatever they do to the patient with the patient. Now, if there's no printer cartridge, it means then that some of the things might go or end up not being recorded, and these nurses might find themselves in front of the nursing council having to account for that, which is not their fault, but it is the fault of the department, which has failed to make sure that there is paper and there's the printer cartridges in that particular facility.
Yeah, and notwithstanding, of course, considering that these would be people who would lost their loved ones and they do require a lot of compassion, is that do we really say that the crisis is ongoing, considering that Mutaletale, as you've just indicated now, had said that this was an issue that was only experienced between the 17th until the 23rd of June. It was sorted out. Only 5 families were affected, but then goes on to say that as of the 25th of June, there was only 1 body left.
Why should families have to go through this? It's a simple thing. I mean, you've got a CEO who has got managers who are working with him in that particular facility. So somebody somewhere is not doing their job. I'm not expecting to go to a facility as big as Helen Joseph. As I said, it's a tertiary hospital. I'm not expecting to go there and then I'm told that the facility does not have a printer cartridge or they're unable to process my documents because of that. It is simply unacceptable. One is one too many to be having that. When there should, at all given material, at all material times, there should be some kind of backup cartridge to make sure that services are continuous. Mm-hmm. But we cannot be having, if you cannot address these small things, how are you going to address issues like a shortage of staff, which affect service delivery? We expect our people to be getting the service that they deserve in the province of Gauteng, not this kind of service.
Yeah. The Democratic Alliance in Gauteng is saying that this is further evidence that under the Panyaza Lesufi administration, both the living and the dead are not treated with dignity in Gauteng. But from a union's perspective, what would you like to see happen?
I would like to see an improvement in terms of putting processes in place to ensure that our people are able to work in an environment where they're able to give the service that they've been hired to do. Because currently, the failure of the systems, the failure of management to be able to make sure that they provide tools of trade for nurses and doctors and all the other people who are working there is failing them, and it's making them look like they're not able to deliver the services that they've been hired to do.
All right. Thank you so much for your time. Bongani Mazibuko is the Secretary for DENOSA in Gauteng.